Hey Doc, this is Bernard Jin. I hope you're having a great day. Most of us are familiar with standard implant crowns that we deliver to our patients. In an anterior case, we strive to keep the implant positioned in such a way so that the access hole is coming from the lingual or cingulum, thus making the prosthetic crown retrievable. However, a few decades ago, we would place the implants, instead of it being prosthetically driven, we would place the implants where the bone was. That would pose a problem because now the access hole coming out of a position that is non-ideal, usually along the buccal or the incisal edge. And so what did we come up with in terms of a solution? Many of you may be familiar with the angled screw channel driver, which allows us to engage the screw head at an off angle, thus trying to keep the access hole on the lingual aspect of the crown. However, we had to come up with ingenious ideas back then before the angled screw channel. And here is one such solution. When we insert a crown onto a non-ideally positioned implant, and we do not want to use a cement retained solution because it is not retrievable, doctors in the past came up with the idea of the transverse inset retentive screw. And the way we did that was to make a threaded lingual hole on the abutment and a corresponding lingual hole on the crown. That way, we could hold the prosthetic crown onto the abutment without actually having to use cement, thus making the case retrievable and cement-free.